The reality TV star Nikki Grahame, who found fame as a contestant on Big Brother,
Nikki Grahame has died aged 38 following a long battle with anorexia.
We don't know for sure what killed Nikki Grahame, but both her life and her death were dominated by her anorexia, a condition her family say reached crisis point during lockdown.
She just felt very cut off and spending actually too much time on her own.
Contribute as much with the washing up. Yeah, but
and while Nikki and her struggles may have been at the extreme end of the spectrum, thousands more are known to have suffered following the full lockdown.
Hello, Nikki.
The latest figures seen by Newsnight reveal that between June and November 2019 and June and November 2020, the number of hospital admissions of people with a primary diagnosis of an eating disorder who are in a life-threatening condition went up by almost a third. And the numbers of those waiting for treatment also went up. There's no data for adults, but in the last 3 months of 2020, the number of under-18s waiting for urgent treatment has quadrupled. And in the same period, the number waiting for routine treatment has more than doubled. Anorexia has one of the highest mortality rates of any psychiatric illness. People with the disorder are up to 5 or 6 times more likely to die than those of the same age in the general population. Even before the pandemic, over the past decade, there'd been a huge increase in the number of people saying they had an eating disorder, and the lockdowns have made this even worse. Lynn went into a specialist eating disorder unit last February, just before lockdown. She says her body was shutting down, that she could barely walk. She wouldn't leave for 5 months.
I don't know whether I'd been here today, if that doesn't sound too dramatic, if I hadn't have gone into the unit. Eating disorder is very isolating, so you isolate yourself, plus you also feel that you're isolated because of the grip it's got on you. So, you know, having to stay indoors, and one of your control mechanisms is exercise, is being able to kind of micromanage what you eat, and not even having the possibility of seeing people. I think things would have got really bad. Don't know whether I'd have been alive, basically.
Experts say eating disorders have surged during the pandemic. Agnes Ayton is the country's leading specialist psychiatrist in the field.
Since the pandemic, we have seen a massive increase in severe eating disorders across the age range. We used to have, before the pandemic, we used to have about 20% of our patients who were referred as an urgent or emergency referral, and that has gone up now to almost 80%.
Because of infection control measures limiting the number of patients, demand has soared, but capacity has significantly reduced.
So, unfortunately, this is almost like a perfect storm. The number of people needing help, needing urgent help, is not matched with the staff and facilities available for treatment.
So do you think this perfect storm situation with massively increased demand and reduced capacity could lead to more people dying from eating disorders?
Well, that's my fear. I think we really need to take this very seriously.
I feel like I need to describe a few things or clear a few things up.
Dora Tomlinson is 19, anorexic, and has documented her struggles with her eating disorder during lockdown. She has been hospitalised in both general hospitals and a specialist eating disorder unit in the last year.
When I was at my worst, thinking I would go to bed at night and be like, you know what, I just don't want to wake up in the morning. Being on the borderline of being like possibly having a cardiac arrest, it just, when you're in hospital, it's definitely a kick in the right direction because it shows you how close and how it could happen at any point.
Tomorrow I am discharging from this unit.
When she was at the specialist unit, it was the first time she'd been surrounded by adults with eating disorders.
they've been in and out of there for 20 years. And I think that really just made me realise that now I've got uni to look forward to, I've got having a family, I've got getting a job, I've got all these things I haven't done yet. Why throw it away just because I want to look a certain way?
But despite the clear difference medical intervention can make, and in contravention of NICE guidelines, people are sometimes being turned away from treatment because they're not thin enough.
The amount of people that kind of I know of who've been told, well, you know, your weight isn't low enough for us to even refer you. Because what else do you have to do other than like lose another 20 kilograms? I don't know. I mean, sorry, I'm laughing because otherwise I think I'd cry and get really quite annoyed.
The government told us it's rolling out early intervention services for young people and aims for them to begin treatment within 2 weeks of coming forward.
It's really a vicious cycle. We desperately need investment into adult eating disorder services. We have some commitment from NHS England that will happen, but we can't be waiting for years and years.
This is not, of course, a new problem that arose with lockdown. Treatment for eating disorders has been under-resourced for years, and without drastic change, we are likely to hear more stories like Nikki Grahame's.